Now we'll discuss about various complications of blood transfusion. So the first one is the very common and the basic one, which is the major hemolytic reactions. So in this, first of all, is a major immunocompatibility reaction. Now in this one, first of all, what we will see is this can occur because of the mismatched blood transfusion. It can occur due to some clerical error. It basically occurs because it basically occurs due to these two reasons, and it causes intravascular hemolysis. Okay. Now coming on to the clinical features, what happens when blood transfusion mismatch occurs. So first of all, what we experience or what we get to see is hematuria, fever with rigors and chills, pain in loins, bilateral oliguria, then leading to acute tubular necrosis. Now, in this, what is the treatment modality? First of all, we must stop the blood transfusion immediately. Then we must send the sample for again for rechecking. Then we must make a coagulation profile of the patient. IV fluids, urine outputs, they are checked. Urine is also checked for hemoglobin. Then diuresis is done with furosemide in the dosage of 20 to 40 milligrams IV injection. Also, it can be done by mannitol 20% 100 ml IV to flush the kidney. Now, there can occur some minor hemolytic minor hemolytic reactions. Now these occur because of the antibodies to minor antigens in the blood. Okay. Now these basically lead to extravascular hemolysis. Okay. Intravascular and extravascular. Now in this also you will see malaise, fever, jaundice, and the treatment is supportive. Then coming on to the non-hemolytic reactions. Non-hemolytic. The first one is very common, which is the febrile reaction. Now this basically occurs because of the sensitization to the WBCs and platelets. Now there is increased temperature. Now either if we use 20 to 40 millimeter filter, or we use anti-leukocyte or leukocyte depleted blood, then febrile reaction will not occur. Then there is another reaction which is very common, allergic reaction. Now this allergic reaction, it basically occurs to the plasma products. It manifests in the form of chills, rigors, and rashes. Now if we have to subside it, we must give an antihistamine like chlorpheniramine maleate 10 milligrams IV. Now there is very important thing. This is the keyword in this whole thing, and many questions are asked. So this is the transfusion related acute lung injury, also called as TRALI. So this basically it resembles the ARDS. Now this basically occurs because of the anti-leukocyte antibodies. These cause the patient's white blood cells to aggregate in pulmonary circulation. So treatment will be similar to ARDS. Also, it re-emits in 12 to 48 hours. Okay. So another one that we will mention about is congestive cardiac failure. Now, in this, basically in treatment, we give slow transfusion, furosemide, packed cell transfusion. All right. Then there is also one more, which is infectious complications. Now, infectious complications like hepatitis, then AIDS, malaria, syphilis. Okay, then we will mention a few more, such as air embolism, then thrombophlebitis. Now, if you remember this well, this should remind you of DVT. Then coagulation failure, then hemochromatosis, then citrate intoxication. This manifests in the form of bradycardia, hypocalcemia. All right, so these are the complications of blood transfusion. I hope I made it easy for you to understand. So, thanks for watching.